Hello, workout fitness health people. In today's video, we're going to talk about a very important subject related to our health. We're going to talk about colon cancer, its symptoms, and ways we can prevent it. Did you know that colon cancer is one of the most common types of cancer worldwide? Unfortunately, this is a disease that is affecting more and more people, and many of them are discovering it too late when treatment is already more difficult. That's why it's essential that you pay attention to the signs and symptoms of colon cancer and know how to identify them. In this video, we'll present everything you need to know about this disease, from risk factors, signs and symptoms, to available treatment options. Stay informed about the most important information and discover how to prevent colon cancer. After all, your health is your most valuable asset. But before we continue, please like the video and subscribe to our channel. Almost 90% of people who watch our videos every week forget to subscribe to the channel and, as a result, they don't receive our videos with tips and a lot of information about health, sports, and fitness in general, which can save your life. And for those who are already part of our family, thank you very much for continuing to follow our channel. Well, now that you've subscribed and we've understood the importance of knowing how to understand the signs and symptoms of colon cancer, let's continue. Before we dive into the details of the signs and symptoms of colon cancer, it's important to understand the importance of discussing this topic. Unfortunately, this is a disease that is affecting more and more people around the world, responsible for about 700,000 deaths per year. Colon cancer is the second most common type among women and the third among men, according to the National Cancer Institute, INCA. About 41,000 new cases of the disease are expected in the country. These statistics show the lack of discussion and awareness raising about the prevention and early diagnosis of colon cancer. That's why in this video, we'll address the main signs and symptoms of the disease to identify possible warning signs. After all, early detection can save lives. What are the risk factors? Some risk factors can increase a person's chances of developing colon cancer. These include age. People over 50 are more likely to develop the disease, a family history of colon cancer, inflammatory bowel disease, and unhealthy lifestyle. In addition, diet can play an important role in the development of colon cancer. A diet rich in processed foods, saturated fats, and red meat can increase the risk of the disease. On the other hand, a diet rich in fruits, vegetables, legumes, and fiber can help prevent colon cancer. It is important to emphasize that, although these risk factors may increase a person's chances of developing bowel cancer, not all people who have these characteristics will develop the disease. Therefore, prevention and early diagnosis remain the best ways to combat bowel cancer. You may be wondering, what are the signs and symptoms of bowel cancer? The symptoms may vary from person to person, but there are some warning signs that should be observed. These include changes in bowel movements such as diarrhea or constipation, which can be a sign of bowel cancer. If you notice any changes in your bowel movements, it is important to seek medical evaluation. Blood in stool with blood can be a sign of intestinal lesions, such as polyps or tumors. The blood may be seen on toilet paper, in the stool, or in the toilet bowl. Abdominal pain in the abdominal region can indicate the presence of tumors in the intestine. The pain can be constant or intermittent and may worsen after eating. Weight loss, unexplained weight loss can be a sign of colorectal cancer. This can occur due to a decrease in appetite or difficulty in absorbing nutrients. Fatigue and weakness, constant fatigue, lack of energy, and weakness can be symptoms of colorectal cancer, especially in advanced stages of the disease. Anemia is a condition in which there is a decrease in red blood cells in the blood. This can be a sign of bleeding in the gastrointestinal tract, as occurs in some cases of colorectal cancer. Abdominal bloating sensation, a persistent sensation of abdominal bloating or discomfort can be a sign of colorectal cancer. Nausea and vomiting can be a symptom of advanced stage intestinal cancer. It is important to be aware of any changes in the intestinal tract and seek medical attention if symptoms persist for more than 2 weeks. Early diagnosis is crucial for successful treatment. Therefore, it is essential not to ignore warning signs. Additionally, it is important to remember that many people do not have symptoms in the early stages of intestinal cancer, making regular preventive exams even more important. Colonoscopy, for example, is an effective way to detect the disease in its early stages when treatment is simpler and more effective. Do not ignore changes in the intestinal tract and have regular preventive exams. Your health is your most precious asset and deserves all attention and care. Prevention and early diagnosis are essential to fighting intestinal cancer. The earlier the disease is detected, the greater the chances of successful treatment and cure. Therefore, it is important to adopt healthy habits such as a balanced diet rich in fiber and low in fats and red meats. Additionally, it is important to avoid excessive alcohol consumption and not smoke. Regular physical exercise can also help prevent intestinal cancer and contribute to a healthier and more balanced life. In addition to preventive measures, it is essential to have routine exams frequently. Colonoscopy is the most effective method to detect intestinal cancer in its early stages when treatment is simpler, and the chances of cure are higher. Do not postpone taking care of your health, as it is an investment that is worth it. Adopt healthy habits and have regular preventive exams. Be aware of warning signs of intestinal cancer. With care and prevention, we can overcome this disease. Treatment: if bowel cancer is diagnosed, there are several treatment options available that vary according to the stage of the disease and the patient's overall health. Treatment options include surgery, radiotherapy, chemotherapy, and targeted therapies, which are medications that specifically target cancer cells. However, it is important to note that the appropriate treatment can only be prescribed by a specialist doctor. Therefore, it is essential to seek specialized medical assistance if there is suspicion of the disease or symptoms that may be related to bowel cancer. Only a healthcare professional can make the correct diagnosis and indicate the most appropriate treatment for each case. In addition, medical follow-up is essential throughout the process to ensure the success of the treatment and the patient's recovery. Do not hesitate to seek specialized medical help if you have symptoms related to bowel cancer. Taking care of your health is essential for a fulfilling and happy life. Did you like the information we shared in this video? Then, do not hesitate to like and share it with your friends and family who can also benefit from this information. And if you are not yet subscribed to our channel, do not waste any more time. Subscribe now to receive our upcoming videos on health and well-being firsthand. Remember that taking care of your health is essential for a fulfilling and happy life, and we are here to help you on this journey. See you in the next video.